I think there are two ways. One is guarding access to the data. So who has access to data? Are they approved researchers? Are they approved commissioners or approved clinicians? And we have an audit trail of who's had access to what data and that they are using it properly. The second thing we have is clear guidelines and clear safeguards in place so that people who do have access know exactly what's expected, know exactly what is and isn't acceptable in terms of use. So that avoids the problems of malicious use where people are getting hold of this data who shouldn't have it. Now that needs to be a criminal act. And I think you criminalise bad use of this data and use of this data which threatens people's confidentiality. There's no two ways around it. I'm fairly hard line on it. I think the data are hugely valuable. We can use them responsibly. We've shown we can use them responsibly as researchers, and we need to continue to do so, but we do need strong safeguards in place.
So there are really two ways in which we are proposing to make this work well. First of all, the government has recently introduced a new series of legislative safeguards to make sure that that this data can only be shared in the most secure circumstances for health benefits. So there's no question that this data will not be used for any other purpose than the benefit of patients, whether today or in the future, as we've discussed. The second thing is that there is an absolute legal obligation on the bodies who have the permission to handle this sensitive data to do so in a way that is entirely consistent with guaranteeing the confidentiality of people. But the truth of the matter is that we live in a digital age, and in our new world, with all its benefits, there is increased risk that people's private personal data, when it's held on a computer, wherever it might be, could be subject to hacking or what sometimes is, people triangulating different bits of data and perhaps identifying a person. Now, even though those risks are largely theoretical, they must be acknowledged. So for that reason, the government has also introduced recently a new right for people, which I strongly support, that they should have the right to object to their data being shared if they're uncomfortable with that happening. So a combination of really solid legal safeguards, but equally a recognition that we live in an age where nothing can be guaranteed 100%, and therefore the right to allow people to opt out if they wish to. That's really how we are going to offer to our citizens a conversation that says, we'd really like you to share your data. We think you want to share your data, but at the same time, if for some reason you're not persuaded or you don't think it's the right thing to do, you have the right not to do so.
We're doing a big piece of work around fair processing so that people are aware of what's going on locally and are able and understand the ways in which they can opt out, should they choose to, and what they might be opting out from. So that's kind of building the foundation for the whole population, really. And then once patients are enrolled into the programme, they're asked for their consent at that point. So there's a more lengthy one-to-one conversation that happens at that point, which is more about, it's about what they're consenting to in terms of the programme, but also what that means in terms of how their information might be shared. And they have a slightly different question around whether they want their data to be shared across health and social care from that against about sharing in health. And I think what we've noticed so far in its early days is that people are much more willing, or actually they think it's slightly bizarre to be asked about sharing their data across health, because they anticipate that happens already, but they're more nervous about sharing their data across health and social care and the other way. We're also asking people, where we've got joined up digital care records, there's also a consent at the point of viewing. So if people pitch up to GP out of hours, they might be asked for their consent to view their records in their GP practice as well. So there are a number of different places where people might, I think there's a lot more we could do, but that's the kind of work that's going on at the moment.